It's 4 o'clock. I'll call the regular session of the Town Council to order. Would you please join me in the Pledge of Allegiance? I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, any public comment?
Can I say something?
Certainly may, go so.
Just wanted to remind you guys, the first full week of May is National Corrections Employees Week, where around the nation we recognize correctional employees. This last week we had some festivities out at the prison, award ceremony on Tuesday. Our Deputy Director Morrill was down. A few community partners appreciated their support. Just want to extend the invitation to you all. Also, next year we'll be having that awards ceremony. I'd love to see any of you that like to come out as we recognize our staff for the good work that they do every day. Also, we have 3 vacant officer positions currently that we've interviewed for, and 2 of them have been filled and wait for the 3rd one. So that'll bring us up to almost fully staffed. And we have 1 position, our Facility Energy Technician 3 position. You have to have a limited electrical license, HVAC experience, preferably some geothermal experience, and it's been vacant for 5 months now. There's 3 positions throughout the state of Oregon, just in the Department of Corrections, that we have no qualified applicants on a list to even interview. So if anybody knows anybody that has HVAC, limited electrical experience, we'd love to have them come out and talk to us. So, everything's going on at the prison. Thanks.
Thank you.
Thank you, Steve.
You're welcome.
How's
your retirement?
No.
Mayor Patrick, do you have some HVAC experience?
I think I would be qualified, but I kindly or I decline. You guys are boxing me in a corner. Okay. We'll go ahead and move into communication comments and informational items. Our first item is a update on CHIP by Mr. John Adams. So John, go right ahead.
All right. Good afternoon.
Hi.
Okay, let's see. Can everybody see this okay, or I have paper copies as well?
I saw him in the wet.
We were up here a second ago.
Sorry about this. Gremlins.
You want to move this way, Scott, so it doesn't shine off your forehead?
Yeah. And
It's gotta distract you.
can everyone see this okay? Do I need to dim the lights? Or I also brought paper copies if anyone needs a paper copy.
You guys want the lights down?
Yes, please. My name's John Adams. I'm the coordinator for the Lake County Community Health Improvement Partnership and the Community Advisory Council. And I moved out here about a little over a year and a half ago from the San Francisco Bay Area. My family and I, we wanted to get closer to family. We wanted to slow our lives down, and we wanted a higher quality of life than what we were experiencing in the Bay Area. And we felt like we could get that quality of life here in Lakeview and in Lake County. Recently, the Robert Woods Johnson Foundation released their annual county health rankings, and they rank quality of life 25th of 33 ranked counties in Oregon. And part of the reason that we rank in the bottom quarter percentile is because of our health factors that impact quality of life. In this category, looking at health factors, we rank 30th out of 33 ranked counties. So in this diagram, you can see how you have health factors and they influence health outcomes. So all of these over here are health outcomes that impact our health factors that impact our health outcomes, including length of life and quality of life. So there's 4 main areas of health factors, including health behaviors, clinical care, social and economic factors, and physical environment. So physical environment factors include air and water quality, housing and transit. Social and economic factors that impact our quality of life include education, employment, income, family and social support, community safety. Clinical care includes access to care and quality of care. And health behavior factors include tobacco use, diet and exercise, alcohol and drug use, and sexual activity. So what the Robert Woods Johnson Foundation is saying is that within these areas, these health factors, we scored poorly. And that contributes to poor health outcomes and a low quality of life for many of our residents. So what can we do about it? So right here, it shows how policy and programs impacts health factors, which impact our health outcomes and our quality of life. So we need new policies and new programs that impact these health factors, or we need to improve and revise our old ones. And that's the work that the CHIP program and the Community Advisory Council has been involved in over the past year. So the CHIP program and the Community Advisory Council consists of 26 people from throughout the county who are representing all parts of our community, including town and county government, the hospital and clinics, mental health, public health, education, early learning, seniors, developmentally disabled, criminal justice, faith, and business. And our ultimate goal is to improve the overall health of local residents. And this is a picture of our group just at our regular monthly meetings. Over the past year, what we've done is we've looked at both quantitative and qualitative health data, and we've developed a health assessment. And through that health assessment, we've been able to identify 4 issues that are a priority for us here in Lake County. And those issues include mental health, oral health, physical activity, and senior services. And so today I wanted to come out here and to talk with you guys about some of our work and our activities over the past year, and also to share with you the strategies that we've come up with that address these issues. And these strategies form our community health improvement plan. So the first thing that we did was to look at a lot of the numbers or the quantitative data that give us a snapshot of what's happening within health and within the healthcare system in the county. We partnered with the Office of Rural Health, who helped to compile a lot of data reports and presented it to our group. And so we looked at demographics, which tell us about the statistics of the county population. We looked at health status, which provides information regarding the community's health, disease prevalence, and other factors that impact the health of community members. Health utilization data tells us about inpatient and outpatient utilization for the local community and identifies where people go to receive care. Provider supply and demand determines the projected need for health professionals for both North Lake Health District and Lake Health District. And we also had a needs assessment checklist, which lists all of the health metrics that we're required to look at by the Eastern Oregon Coordinated Care Organization. So we also looked at qualitative community health data, and we did that primarily through 2 means. So one, we sent out a health survey in the mail to a sampling of the whole county. We sent that out to 1,500 residents, and we received back over 44%. So we had a really strong response rate, and we got a good sense of what folks are thinking and how they're feeling about health and healthcare in the county. The left photo there is just it's a question that was on the survey and the survey results. We organized community meetings on September 26th of last year. We organized community meetings called Keeping Healthcare Local in Lakeview and in Christmas Valley. And subsequently, we also organized one in Paisley. And we had good participation in those community meetings, and it was a way for us to get more input from the community about health and healthcare. And the results of the surveys and the community meetings are found in the needs assessment document that I've provided you all. And also, if you guys wanted to look at any of the qualitative data reports that I just talked about, or any of the results from the male health survey or the community meetings, you can also go online and you can look at the CHIP webpage, which is linked through lakehealthdistrict.org. Once we compiled all the data, we were able to summarize it, and we found that there were themes emerged. And we found that 10 areas were found all throughout the data. And those 10 areas include dental, access to medical care, senior services, prevention and promotion, drugs and alcohol, transportation, mental health, affordability and financial assistance, physical activity, and communication. So all throughout the data, we found those things coming up pretty regularly. And so what we did is we used a decision-making tool called a forced choice matrix. And that helped us to whittle that list down from 10 to 4. And those 4 issues I mentioned earlier are oral health, mental health, physical activity, and senior services. So these are the top issues that we've identified for the county and that we want to invest some time and energy in and to put some strategies together for. After we identified the 4 issues, we formed some work groups around each one of those issues. We invited other folks from the community to come out to join us, and folks who are working within those areas or have an interest in those areas to come and to help us develop new strategies in those areas and ultimately try to improve community health. And the strategies that they developed are what form our Community Health Improvement Plan, which was just approved at our last meeting, which was April 17th. And so I want to share that with you guys today. So first of all, looking at oral health, we looked at how dental caries or cavities, how they're the most chronic childhood disease and how it primarily affects low-income children. Additionally, the 2012 Oregon Smile Survey indicates that Lake County children 6 to 9 years old experience cavity rates that are significantly higher than the rest of the state. Our cavity rates are about 21% higher than the rest of the state. And so what we wanted to do, one of our strategies is to administer a dental sealant and fluoride varnish programs to eligible school-aged children. So I think this is an example of how this program is a real benefit to the community because we're able to shine a light on areas that we've neglected. In this case, what we found out is that these programs have been, every elementary school in our county has been eligible for these free state-funded oral health prevention programs, but somehow we've just neglected to participate in these programs. And so the solution is simple. We want to bring these programs back. We also looked at, so the health survey results revealed that 38.4% of the survey respondents indicated that they do not get all the dental care that they need here in the county. However, we don't know exactly what dental care they specifically do need. So we need more information. So one of our strategies is to conduct an adult oral health assessment. So we're gonna get a oral health survey, send it out to a sampling of the county. We're also going to provide a oral health toolkit, which includes a toothbrush, toothpaste, and dental floss as a way of promoting oral health preventative practices, and also we hope that it's an incentive for folks to send the surveys back to us. And then finally, we felt that there's a lack, generally just a lack of oral health information that's out there in the community, and information about nutrition, oral hygiene, tobacco, gum disease, meth mouth, and even a lack of information about the dental programs and services that are existing and available to county folks. And so one of the strategies is that the CHIP program will partner with Advantage Dental and conduct oral health education, promotion, and outreach through community meetings and events, leafleting, and announcements with community organizations, and paid advertising. For mental health, we looked at how we have a high percentage of individuals who self-report depression and other mental health symptoms. However, they fail to seek the appropriate care. Additionally, in the county, we have an access issue because we have a lack of trained mental health providers. So one of our strategies is to implement is to work with Lake County Mental Health to implement the mental health first aid program. And this is a program that'll train teachers, nurses, EMS, county and town employees, and other governmental and social service organizations to identify, understand, and respond to individuals who may be experiencing signs of a mental health illness or substance use disorder, and to administer first aid. And first aid essentially is to connect that person with the appropriate mental health and substance use providers. So it's a strategy to work with the community, to get the community more involved, to train them to understand and be able to identify the symptoms, and then to be able to connect that person to the appropriate care. The other strategy is to work with Lake County Mental Health and to integrate a mental health provider within the primary care clinics. So Lake County Mental Health would provide mental health providers within the 3 clinics within the county. And what that does is it provides more access to the community. It's another access point. It also it reduces the amount of mental health related cases that the primary care physicians are seeing, and they're able to just hand those off to the mental health providers. And then it's also it's another access point for the community that's I don't know, maybe they feel safer about going into a physical health facility versus the stigma of going into a mental health facility and seeking mental health services. In terms of physical activity, so both qualitative and quantitative data, so the survey and the numbers in the reports indicate how individuals within our population have high risk factors for heart disease, which is the second leading cause of death in our county. So we have 41% are overweight, 19% of our population are obese, 45% of adults have high cholesterol, and 44% of the survey respondents indicated that they were told by a health professional that they have high blood pressure. We also looked at and felt it was significant how in the Lakeview community meeting in last September that at the end of the meeting we asked everybody to vote on the top idea to make Lake County a healthier place. And the top vote getter was a year-round fitness or recreational facility and programming for all ages. So our strategies are, one is to promote physical activity. So Lake County CHIP will be the lead organization to provide health education, outreach, and health promotion activities, including we'll conduct a physical activity inventory and assessment. We'll create a community website focusing on physical activity and health promotion. It will administer a physical activity scholarship program that will be targeted towards low-income individuals with high risk factors for heart disease. So we want to get these guys and say, you know, here's a scholarship, you know, go out there and do yoga or do the gym or Pilates or whatever is out there in the community, go out and sign up for dance classes and, get more active. And also we want to enhance and promote existing walking routes within the community. There's also a long-term strategy to work with other community and governmental organizations to establish a Parks and Rec program or a nonprofit organization with centralized and coordinated programming and facilities. So we're currently working with the county to go after state grant funding to be able to go through a process to create a master plan around Parks and Rec in the county. In terms of senior services, the most kind of stark demographic statistic that we looked at is within the senior population. Over the past 12 years, we've seen an increase of 44% in the senior population within the county. So it's a significant increase. And we haven't necessarily seen a parallel growth in the services or the utilization of the services. We really felt that we have this great resource in town with the senior center, but the programs are really underutilized. So one of our strategies is to partner with the senior center and to create a half-time outreach and volunteer coordinator position and to get folks more involved in programs. And we're targeting home delivery meal program, congregate meals program, transportation, and home care programs. Additionally, we want to partner with Lake Health District we want to assist and support their efforts around establishing an assisted living facility. And also, we want to partner with the Outback Retirement Center up in North Lake County to expand programs and services and assist and support their efforts to create the senior center facility up there. So our next steps are we're organizing a community meeting. We want to go up and invite the community to come out and to hear about the work that we've been doing over the past year, the strategies that we've come up with, and to share with them our community health improvement plan. And I wanted to invite you all to come out and to join us for that. So it is scheduled for Thursday, June 19th. 5:30 to 7:30 at the Elks Lodge. And so part of the meeting will be educational, and we want to share what we've done and the community health improvement plan. And part of the meeting will also be, we want to get further input from the community and over the course of the next year, we want to develop a 3-year plan for community health improvement in the county. And so what we've come up with so far will be the foundation for that, but we want to build on that over the next several months. And so the input that we get from the community from this meeting will further inform and shape our strategic planning process. In terms of quality of life, I started off talking about quality of life. Quality of life is attainable in Lake County. However, there's a lot of health factors that are working against us. So the community health improvement plan is a good first step towards impacting those health factors and improving our quality of life. Me and my family, we plan on staying here a while, and I think it's fitting for me to be involved in this work, trying to improve quality of life and overall health in the county. And, excuse me. And I'm driven every day by the folks that I work with in our group and out in the community who show a commitment and a real enthusiasm about trying to make changes. And I found that they're actually hungry for making these changes and trying to improve quality of life in the county. I want to end just by saying thank you for supporting us last year in organizing on National Rural Health Day and recognizing that as a significant day for our community, and participating in the food share program that we put together. We were able to raise over close to 770 pounds of food in a very short period of time, and get that out to folks for the Thanksgiving holiday. So I want to thank you for that. As we develop our outreach activities around the oral health and physical activities, I'll likely want to come back and talk to you about what those look like, and possibly work with you guys in helping us to try to promote some of the physical activity and oral health activities.
Thank you.
Thank you, John. Appreciate it. Okay, our next item is news release. Let's see, I guess the rest of this is just informational. Any questions or comments from the council on any of those items?
I'm sorry, this is just a flyer about the event.
Oh,
No, okay.
thank you.
Thanks.
Thank you. Okay, if there's no comments from the council, we'll go ahead and move into the department reports. First item is Chief Camp is not here, so I guess his report's good. Mr. Utley was here, where did he go?
He had a call.
Okay.
Emergency call out.
911 call.
Pardon? Okay. No fire chief here. Mr. Anderson's report's in the package. Mr. Wilkie, anything to add to your report?
No, nothing bad.
Okay. Mr. Sims?
I didn't get one in. You want me to add to it?
Yeah, or do you have anything that you do need to bring to our attention?
I'll do that in the manager updates.
Okay.
That'll give me more time to think.
Take some notes, take some notes.
Okay, the next item is the consent calendar. There's a couple things on that. On one of them, on page 3 of the April 22nd meeting, you have the motion passed 4-0, and it was actually 3-1.
April 22nd, on what page?
It's on page 3, top of the page. And then also,
Which meeting were you in, Mayor, on that one?
pardon?
Which meeting were you in?
That's on the April 22nd meeting. There was only 4 of us here. And it says Councilor Warren abstained. He had not reviewed the minutes, so it could only be a 3-1 vote, not a 4-0 vote.
Okay.
So that's why I corrected that.
Well,
Pardon?
well,
Huh?
he wasn't in opposition,
No, I didn't.
But he didn't vote.
but he didn't vote, so it would be a
3 to 0.
3 to
3
0.
to 0.
3 to 0, not 3 to 1, okay.
All right. And then on, I'm not sure which page it is, but the very next page, I see no entry where ordinance number 848 was read in its entirety. It says, we passed a motion to read it, and it says the motion passed unanimously 4-0, and then moved on to another business. It should state in there that we did read it. That would have been the first reading. So I think it needs an entry stating that it was read
Okay, so.
In its entirety.
in its entirety, yes, that's correct.
Well, that was just a motion to.
Oh, to motion?
Mayor, can I,
Yeah, the motion's there, but
Okay.
it was completed also, so.
Mayor, can I
Yes.
make a request? With the changes that you're making, I certainly need to know what they are, but I haven't had a chance to read any of the minutes from the previous meeting, so once again, I'll abstain if you guys want to go and vote on it, but I didn't get my packet, as we usually do through email, and I didn't get by here to pick it up, so I have not read over the minutes from the previous meeting, so I would say put it off until the next meeting. I would feel more comfortable. Or you can give me a few minutes and I'll sit here and read over them.
We can certainly do that. Which would you be more comfortable with? You want to- Let's table the minutes, until the next meeting, and it'll have the corrections in it
Okay.
or something at that
And if
time.
you had some more corrections, go ahead.
Okay, I have one more correction. It's on page 2 of the April 29th special council meeting. Excuse me. At the top of the page 2, it says Mayor Mike Patrick called the regular council meeting.
Oh.
Should be a special council meeting. So those are all the corrections that I found, but
Do I need a motion to table it?
I think I can just go ahead and table that part of the consent calendar, but I think we should go ahead and approve the rest of it, or if the council would like to. Or same thing, Mike, you haven't had a chance to read that either, huh?
Well, I really haven't. The other would be, what, accounts payable?
Accounts payable.
So
Okay.
no, I haven't looked it over. I'll just,
I'll-
like I said, if you guys want to go ahead, I'm sure you.
I'll just tell you, well, truthfully, to abstain from a vote, it's, by our charter, it's supposed to be only if there's a direct conflict, conflict to abstain. So I'd much prefer to table this, the consent calendar.
Okay, but it doesn't cause too much of a.
Yeah, no, it's not a big deal at all, I don't think, so.
Okay.
We will table the the consent calendar. And we'll go ahead and move into mayor council updates. I'll lead off on this. I attended the TM 2.5 meeting today, which was a noon till 2 o'clock meeting, and I also participated last week in the utilities clerk interviews. And let's see. Oh, and I also met with the new fireworks committee on how we're going to fund and what we're going to include in our 4th of July celebrations. But it's a newly formed committee. Mr. Sims is on it also. But the one thing as a community, we don't want to lose our 4th of July celebration and our fireworks. It's important to our communities, so I'm happy to serve on that committee, and we'll see if we can get something out of it. So that's all I have. Sandy?
I just attended the planning commission meeting last night.
We got something going on?
Well, nothing, a complication, let's put it that
Oh,
way, in a permit.
Is that all?
Yeah.
Thank you. Michael?
I haven't done anything the last couple of weeks.
I do have a question. I know that the ag banquet is coming up here in the near future.
Yeah.
Are you planning on going to that?
I wasn't planning to.
You weren't?
Nope. Would you like me to?
Well, I'd like somebody, I'll try to go if you're positive you can't make it. Just let me know. I'm not sure that I can either, but I'd like to have somebody there. There's a good bunch of kids, and plus it's a great free meal.
There's always that.
Okay.
I guess I could say that I did go down to the ag department's Mother's Day sale for their stuff, and it seemed like things were going pretty well. But I think they got a little excited about their tomato plants and put them in too early, and they had actually, Jennifer had considered having the sale a couple of weeks earlier, and that probably would have been good for the tomato sales, but I think everything else did pretty well.
Okay. Thank you. Mike?
Mayor, the only thing that I would have would be the Red Rock biofuels. We're continuing in negotiations, and the last we heard from them, and Ray may have some more he would expand on. In the last meeting we had, it was last week, I think, with Ray, was that they're awaiting Department of Defense decisions. And so I guess if that decision rolls this way, we'll be in more negotiations for sure.
Okay.
So, but it's looking positive anyway at this point. So that's one thing I had. And then I didn't attend the SCOAC meeting on Friday, but I think Ray was over there. He's on the executive board, and he probably has some information to give Bill
Okay.
on that. So.
Thank you. Ray?
I've attended most of the same meetings that everybody else has, and yes, we did do utility clerk interviews, and we will have a new person here tomorrow, will be her first day. It's Melinda Alexander, and so anyway, she'll be here starting tomorrow. there's really not much more new about Red Rock, other than, as Mike said, we had a meeting, phone conference last Thursday afternoon, and primarily it's a matter of whether or not they get awarded the grant, the contract that they're hoping for from the Department of Defense. However, we are working through, continuing to work through some of the issues with regards to the enterprise zone and community service fees that might be associated with that. We didn't get into a lot of detail Thursday with regards to that, but it's still kind of the the elephant in the room that we're going to have to eventually get around. How natural gas may be provided into the community of Lakeview is kind of what the topic of discussion is around that at the moment. The swimming pool project is going along nicely. It's almost finished. The caulking, I think Ron said that they would finish the caulking today. We have tested the pump, the water in the well. I'm not sure how many hours they pumped it, but for a few hours, it warmed up to 90 degrees. And that's maybe a little bit more than that. It might be, it's slightly warmer than it was tested last year when Public Works guys measured the temperature. So, it seems to be a little bit warmer, a little bit, not a lot, but a little bit. But, it may make quite a bit of difference because, we're not going to be leaking the water that we used to. So, we may be able to warm it up, let a little water out, and put a little fresh water in. Anyway, that project will wrap up by the end of next week. For all practical purposes, there's going to be a few little things left to clean up and do. Labor negotiations are Thursday this week. Michael and I are anxiously waiting. I know he loves labor negotiations.
Turning loose.
The man is sick. I apologize for not getting my report in, but you pretty much know what I've been working on for the last month or so. That's budget, wrapping up the geothermal things. I think within the next 2 weeks we will, probably at your next council meeting, in fact, you're going to have some new loan documents to have to approve with regards to the transfer of the project from the U.S. Bank interim financing loan to the USDA. That may actually be in early June, but I'm sure hoping that we can do it before the end of May. I think I've covered most things.
Okay.
Any questions?
Okay. We have no old business, so we'll move into new business. My first item on the agenda says a request for a Lake District Hospital, or Lake Hospital District for a stop sign, and I have no information on that.
Okay, actually it was given to me verbally. I have a letter from the hospital that had identified some safety issues down there. This was actually one that they wanted to deal with, but it wasn't on that list. You don't have to act on this today. Maybe the best thing to do would be, if you're down there, to just take a look at what the circumstances. I mentioned it to Ron. I don't know. Yeah, I know he knows where it's at. Yeah. And what the circumstances. When you come across in front of the doctor clinics from 6th Street towards the hospital emergency room exit, emergency exit entrance, there's a stop sign there by the sidewalk before you make the turn onto 7th Street. If you go down 7th Street, there is no stop sign, but you have to make the turn the other way, and there's a crosswalk, and there's been some near misses on the sidewalk from people going down 7th Street and turning, stopping, but not seeing the pedestrian traffic. So they would like a stop sign on 7th Street so that whichever direction you may be coming there to turn, that you would have to stop.
That seems like a total waste of a stop sign to me.
I thought so too, but.
It dead ends right there. I mean, the street stops, there's no way to proceed forward. I don't see, you gotta slow down to make a turn. I'd be willing to discuss it with the hospital people, but I think it's a real waste of time.
Well, I have asked them since Ron I talked about it, I did ask them to put their request in writing so we'd have something to look at. So we don't have to act on that one today.
Okay.
So you're talking right in front of the hospital entrance?
Right in front of the
end of
Going down
7th.
7th Street and
Yeah.
I
you're
kind
turning
of
right.
agree with having a stop sign there because you don't really look as good when you're just zooming around the corner, actually.
I can see this, we need some discussion.
And then probably when they drive by, they light up and fly.
I've driven down there a number
I've
of
been
times.
there, yeah.
And I,
I've never noticed that. I
and
think
I
I stop
also-
every time anyway, but I don't know
Yeah.
if it's just because of the congestion right there that
There
it
is-
seems like you should stop or whatever, but.
As
Well,
far as I'm
We'll
aware,
make
I
a
haven't
decision
seen
after we
anybody.
see. Council, if I may, I see Mr. Utley's back. Did you have anything to add to your report, Scott? Okay,
No, still working on getting our servers and stuff going, but
okay, thank you. Our next item is a request from Detra Isham on the McDonald Park balloon release, use of sidewalk. Did y'all get a chance to read her letter?
well, my question is, what are luminaries?
They-
I'm behind.
We did them one year for the Christmas program. What we did is when they put those little Baltic candles or whatever in a paper bag and light
Oh, I
them.
see.
And it's just a little,
Fire hazard.
yeah.
Where's
No,
Dennis
you know, I personally, I don't see a thing wrong with it. I would, you know, if we give her permission, let her know that we do expect a cleanup of whatever they do, but it's to celebrate her, I guess it's her child's beating cancer, which I think is a great thing, and if they want to do that party. The only other concern that Ray and I had is, on the original request, it made it sound like they wanted to line some other streets, and some of them were Highway 395, but I think if she leaves her luminaries back along the fence line or back from that, she doesn't even need to worry about Highway 395 at all. It's not actually on their right of way or anything, so I think we should let Mr. Sims know to tell her to go right ahead and make sure she cleans up her mess.
I would recommend that they have some kind of water hose there,
With the.
just
yeah.
because of the luminaries.
Okay,
You know, and the dry grass at that time of, you know, we are in a drought season, et cetera.
Mr. Sims, will you let her know that?
And I think the correct pronunciation is luminarias.
Oh, Illuminati.
I'm from New Mexico.
Illuminati, I thought that was, no, never mind. Okay, we have one other request from Joanna Villagrana for the use of one spot parking space at the town hall parking lot for a graduation party. It's not for the party itself, but to set up a barbecue for the party. I see no problem with that. Would you notify her also, please?
Yeah, they own the building there and just needed a place for barbecue.
Yeah, okay.
Okay.
There's no other business before the council. Any comments, questions, anything? You wanna go home?
Yeah.
Anything else from the audience? Okay, I will adjourn the regular session of the town council at 4:44.
Yay.